Hello everyone. Welcome to the AVPN webinar on collaborative approaches for fostering healthcare innovations. I'm Kavita, Manager Knowledge and Member Engagement at the Asia Venture Philanthropy Network, AVPN. AVPN is a unique funders network committed to building a high-impact philanthropy and social investment community across Asia. Currently, we have over 600 plus members across 59 countries. And we are very pleased to have two of our members based in India speaking today. Representing Xynteo India, we have Dr. Ashwin Naik, who is the Senior Advisor there, and Shweta Bhardwaj, Associate Director Global Policy at Johnson Johnson. Dr. Ashwin Naik will enlighten us on how to solve systemic challenges in healthcare through collaborations, and Shweta will share with us insights on scaling innovative solutions for mental health care in India. Before we proceed, a few housekeeping instructions. We will not take any questions during the presentation, but will open up the floor for Q&A after the speakers have presented. But please feel free to type in your questions in the Q&A box while the speakers are still presenting, and I will raise the questions to our speakers in the Q&A sessions toward the end of the webinar. If you have further questions that are not answered by the end of the webinar, you can email us at india@avpn.asia. With great enthusiasm, I will now hand over the floor to Dr. Ashwin.
Thank you, Kavita. And it's a pleasure to be here to share what we are doing at Project Tej. Let me start with a brief introduction to Zinter to set the stage, and then we'll go into the meat of the presentation. Kavita, next, please. So Zinter is a Oslo-based consulting organization focused on social and at the intersection of social and business. And in India, Zinter is working with multiple partners, like you can see on the screen. Some of the leading companies in India who have come together to solve systemic challenges. And there are 4 tracks right now: energy, healthcare, waste management, and agriculture. So these are the 4 sectors that Zinter is working on. The next one, please. And a few years ago, the companies which are working with Zinter came together and created a coalition called India 2022, which is a purpose-driven coalition to transform, to support and scale transformative projects across India. And the way it is being executed is bringing various stakeholders on the same table, including government, private sector, startups, NGOs, and taking up challenges which could be relevant to India and also the region over the next 5 to 10 years. Next one, please. In the healthcare track, which we are talking about today, when we looked at what is happening in the ecosystem, and specifically with medical innovation, if you look at the 3 key stakeholders, the first one is the startups and the innovators. The second is the end users of medical technology, whether it is hospitals or public health settings. And finally, the people who are investing in this sector, whether as venture capitalists or as industry players or as funders who are interested in this space. Over the last few years, across India and across many parts of the world, there has been a big focus on early stage innovation and support for medical technology. But very few of those technologies end up being scaled and utilized in the public and private health sector. And when we looked at this problem, we identified 2 key challenges. One is the startups or the innovators don't have access to good quality test beds where they can test their technologies. And on the other hand, the public sector and the private sector felt that they did not have enough validated technologies that they can adopt. So the entire focus of Zinter healthcare impact track over the last few years has been to bridge this gap. How can we bring innovators and the end users in a collaborative fashion, supported by industry, supported by other funders, so we can look at this challenge of scaling innovative solutions and take them to the market. So over the last few years, we have worked with various organizations, including governments, medtech startups, foundations, and hospital providers. And the idea is, how can we bring together a coalition to solve this problem of last mile access to healthcare technology? So next slide, please. Some of the challenges in the medical ecosystem that you all know of, the life cycle or the life cycle of product testing and validation is fairly long, and there are lack of resources at last mile, both in the developing world and also in the developed world, as COVID has shown in the last few months. And the different stakeholders in this ecosystem don't necessarily talk to each other, and hence there is a huge gap. And of course, because it is medical technology, there is a regulatory and public health procurement process which needs to be navigated by the innovators. So our focus is to sort of act at all these points and figure out a way to accelerate medical technology adoption. And one of the key things that we have been focusing, which is very relevant to this conversation today, is how do we make sure that the investment that goes into early stage medical technology bears fruit and the technology end up being used by the stakeholders, whether it is hospitals or public health facilities. Next slide, please. So we launched this initiative called Project Tej in early last year, February of last year. And fortunately, with strong support from the medtech and the government infrastructure in the state of Telangana. And so we have been able to bring on board the government, a whole range of stakeholders, particularly hospitals, private hospitals in that region, startups, and various other agencies. The idea is, how do we build this, what we call a playbook for medtech innovation, not at the early stage, but at the later stage. And we'll talk about some of the successes that have come through this partnership or this alliance in the next few slides, and also how we would like to invite all of you to come and join us as well. Next slide, please. So what do we do as part of Project Tej? It all starts with identifying the right stakeholders and defining the problem. That's where we start with. And once we've identified the gaps, once we've identified the right stakeholders, we look at what are the solutions which are already available, either within our network or through our extended network of partners, and then identify the real world clinical settings that might be required for that technology to scale. A lot of innovation which happens either in the universities or small startups struggles to find the test beds, whether it is hospitals or ambulances or even COVID testing areas in the last few months. Then once we find the clinical settings, we also identify the right industrial partners who can help with product design, we can help with regulatory approvals and things like that. And then hopefully once the technology passes through these validation, we can then identify ways for them to be used by the public or private health sector. So this is sort of the test bed that we are building for early stage innovations to reach the last mile. Next slide, please. So like I said, we've been able to bring in a lot of stakeholders. And what is interesting is we've been able to bring stakeholders across the board. The government through the state of Telangana and other states that we've been able to engage. We've also been able to bring in multilaterals like USAID, PATH, and others as partners, leading philanthropy organizations like SBI Foundation, Tata Trust as part of this coalition. We work very closely with the other ecosystem players like CCAMP and Social Alpha, whose focus is early stage innovation, and then we bring in the later stage access to clinical test beds. We've had great success over the last 12 months, lots of interest in this space because everybody sees this as a huge gap in the ecosystem. Next slide, please. So let me illustrate this with a case study of how this pans out. When COVID started last year, the state of Maharashtra, particularly the city of Mumbai, was facing challenges in screening large number of people, and they approached us. And with our partners, we were able to co-create a solution which was then deployed fairly rapidly, and we were able to scale and screen about 8,000 odd people. But the most important part here was this was not one technology or one company which came and found a solution. It was a coalition which came together and found the right solution within this network and then deployed it. So this is the process that we use once we identify a challenge, either in the public health sector or in the private sector. We convene the right partners. We identify what is available either by one innovator or by a group of innovators, then figure out what is the model that can be used to test it out and scale across the system. So this was recognized by the state government in Mumbai, and hence has been replicated in private sector as well. Next slide, please. So as we go to the next phase of this project, what we are really looking for is like-minded partner who are thinking about the challenges in medical technology, particularly in the last mile. The second question that we are inviting partners to work with us to figure out how do we make this sustainable in the long term, which is if there are multiple startups in your portfolio or companies that you're supporting, how can they be part of this test bed, and then how can they get to market. We have started with one state in Telangana. We are now expanding into multiple states. We want to see how we can create a playbook that can be adopted across multiple states and taken to those states as well. We're also very keen on figuring out how do we engage private sector, specifically focused on medical technology, and bring their skills, whether it is regulatory skills, whether it is market access, or whether it is technology development, and the whole host of talent that private sector has. How can we use that to add strength to this coalition? So I will pause here and happy to take questions about the Project Age Alliance and what we want to do specifically. But this hopefully has given you an overview of how we are trying to tackle the gaps in the late stage innovation by building a collaborative approach to medtech innovation. Thank you very much.
Thank you, Dr. Ashwin. We'll just launch a poll, and I request all the attendees to kindly let us know. We close the poll now, and I'll share the results. Thank you everyone for participating in this poll, and now we move on to the next poll.
Hi, good afternoon, good morning, good evening, everyone. Apologies, my video camera is not working, but Kavita, next slide, please. So, uh, just to give you a brief background on J&J, we are the world's largest and broadly based healthcare company, and particularly with respect to our global community impact, which is our foundation. Uh, uh, there are 5 focus areas that we focus on. At the center of what we do is the Center for Health Worker Innovation, which really, which is really working on training and development, as well as providing leadership opportunities for frontline health workers. We are also engaged in areas such as local giving, talent for good, disaster response, and product donations, as well as we also have a patient assistance foundation to enable patients without coverage to receive J&J products. Next slide, please. So the use of social impact bond, if we see, it's a very recent phenomena in the development sector space, for which I mean that it's just about a decade old. And if you look at the trajectory from one impact bond in 2010 to now, it is the end of 2019, we have close to around 174 impact bonds that we know of in about 32 countries, a mix of developed as well as developing countries, as we see. And there have been considerable impact bonds or development impact bonds which have been tested and tried in the health space as well, with almost 25 that we know of globally and 5 that we know of in the developing countries. Now, the average upfront capital in a typical impact bond is around $3 to $3.5 million. And it's close to around 4 to 5 years is the average contract period. Next slide, please. Just to give you a brief background on what such an impact bond looks like and how does it really differ from a traditional beneficiary grant relationship, is the introduction of players and the role that they play. There is the introduction of upfront funders in the impact bond, which basically provide upfront funding to scale services of the service provider. There is definitely a very important role of the service provider to deliver services to the target population. There is also a very important role of an independent evaluator to really measure success and outcomes on the basis of predetermined matrices. And if the program is successful, the upfront funder, the outcome payers, which is usually in a developed country context, usually is the Ministry of Health or any state government department or any government department in a developed country context. In the developing world, usually outcome payers are donors or philanthropists. So they are the ones who repay outcome funders if the project is successful. Next slide, please. In terms of range of benefits for multiple stakeholders to really come in and really be part of this kind of a structure, is that for outcome funders such as government or donors, it would build a culture of which is focused towards achieving outcomes. So basically, it is to say very simply that you're not really paying for inputs and processes, but you're paying for measured outcomes. For impact-driven organization, of course, it drives their performance and it gives them flexibility and accountability. And for investors who are really want to link their financial returns to social outcomes, it's a great space to catalyze and bring innovative ideas, bring innovations to scale. Next slide, please. Just to give you a little bit background on the India's mental health landscape, well, as you can see, in the last maybe a decade or so, there has been a significant increase in the prevalence of mental health. In fact, India's mental health crisis affects almost 15% of its population. Now, what is really worrying is that in the productive age group, suicide is actually the third largest cause of death. Now, despite of being such a big public health problem, India's expenditure on mental health is just about 1.3% of the overall government health expenditure. And without being historically prioritized across Indian states, mental health has been, of course, further exacerbated by COVID pandemic, which we'll see in the next slide. Next slide, please. So if you look at the prevalence of depression, anxiety, and stress, it has definitely significantly increased from pre-COVID era to the post-COVID era that we are living in. And we know from experience of similar pandemics such as SARS that people who recover from these, this disease or virus would experience, PTSD, post-traumatic stress disorder. So we have data which tells us that, mental health status of SARS survivors, as you can see, almost 26% of people actually were living with PTSD even after 30 months of completion of their treatment. Next slide, please. So our project vision really is to enable scaling up of innovative and effective ways of service delivery in mental health space, particularly working with community health workers, and through pay for performance or pay for success impact bonds. Next slide, please. So just to give you a typical illustration of what are the kind of challenges that we face across the mental health care continuum, usually a patient takes close to about 1 to 1.5 years before initiating care, which really worsens health outcome. As illustrated by this flow chart, we are depicting story of Savitri, a 45-year-old resident of Rohtak, who recently lost her job and was feeling low. And as you can see, across the care continuum, right from seeking care to actual diagnosis of the care, correct diagnosis and initiation of treatment, there's a significant lag in time that for patients to actually actually initiate care. And then for those of them who actually do initiate care, there is a significant challenge that they face with respect to adherence to care. And as you can see in this case study, at the end of the day, even Savitri did, initiate care, she dropped out of her treatment, and then ultimately it resulted in suicide, in a really, kind of an adverse health outcome. Next slide, please. Now, for the purpose of our project and for really testing pay for performance instrument in mental health space, there are some of issues across the continuum that we have really prioritized are four of them. One is, of course, low intent to seek care, and the other issue is lack of information about care, and limited access to care, as well as lack of ability to adhere to treatment. Some of the outcomes that we would wish to focus on are improved health seeking for mental illnesses, as well as improved mental health outcomes among patients who are receiving continued care. For the purpose of our project, we have shortlisted 2 disease areas. One is depression and neurosis. The other is schizophrenia. I will not dwell upon the landscape of mental health since I've already spoken about it, but I would like to point out that almost, if you can see the statistics, 85% of patients actually do not get access to proper mental health treatment. And almost about 3 to 4 million people in India actually need hospitalization on account of mental illnesses. And we are very well aware of the skewed human resources for health in terms of the availability of, trained psychologists, psychiatrists, which is predominantly they're only, concentrated only in urban and semi-urban areas, which makes, tackling mental health issues really, really challenging at the community level. Next slide, please. So for the purpose of our, project, I mean, we do understand that to improve mental health care delivery in the country, we will need effective, innovative, and scalable mental health intervention. Now, some of the elements of this intervention will include establishing a well-defined care pathway for frontline health workers to detect, to counsel and refer individuals at community level, as well as conducting behavior change communication campaigns to destigmatize mental health issues and present options of care for both patients as well as the caregivers. And of course, we're living in a COVID world, so improving healthcare accessibility will also involve some form of leveraging, digital tools and strengthening the primary healthcare services, both at the primary as well as the secondary care level. Next slide, please. So the question really is that why innovative financing, and in particularly in this case, why innovative financing for mental health? Now, really, if you look at the key barriers to mental health financing in the country, they include, first of all, low spending on mental health care, and the other is underutilization of available expenditure, whatever is budgeted for mental health. Now, in the last few years, however, we know that impact financing has emerged as a significant investment opportunity that not only delivers measurable, health impact alongside financial returns, but also increases access as well as improve efficiency of funding, specific disease or conditions. So we believe that partnering with philanthropic actors or private sector can, the private sector can adopt impact financing models for mental health care, thereby complementing public funding and mobilizing resources to scale innovative mental health care delivery models. Next slide, please. In terms of the instrument, we wish to implement the instrument in Q3 of this year. The investment that we are looking at is around $2.5 to $4 million. The target population is about 3 to 5 million in Gujarat, in select districts of Gujarat. So that's really broadly the instrument that we are planning to stand up this year. Next slide, please. So just to recap key takeaways, I would like to summarize that, India's mental health burden is definitely a result of low intent to seek care, lack of information and access to care, and it has been definitely further exacerbated due to the COVID pandemic. The other point which is important to note is that innovative finance does have a potential to improve outcomes per dollar and leverage additional capital for mental health care in the country. And mental health care pay for success instrument, which we are trying to implement this year, is looking for partners and collaborators, particularly donors who are mission aligned with us. That's it from my side. Thank you very much.
We will now start the Q&A with the speakers. All the attendees are requested to kindly post their questions in the Q&A box. I will start the questions with Dr. Ashwin. Someone wants to know, how are the medtech innovations funded in Project Page?
Yeah. So fortunately in India, at least over the last 10 years, there has been a huge interest in funding early stage innovations. So we're seeing a lot of these startups and innovators having mobilized funding either from private players or from government or from philanthropic organizations. So many of them have secured funding. There's also a coalition of partners that we work with who are constantly looking for interesting ideas. So if there is a need for funding, we facilitate that discussion. But really our role is not to focus on the funding side of the activity, but really clinical validation and market validation. It continues to be a challenge in the medtech space to identify the right sources of funding, but we have focused on people who have funding and are looking for validation.
The next question is for Shweta. So Aparna wants to know that we've been working in innovative finance for a while and are currently working on an SID with MH. Wanted to ask if the government has agreed to come on board as an outcome funder.
Thanks, Aparna. That's a great question. Now, for right now, in terms of our alignment with the government, we are looking at the donors and private philanthropists as outcome funder. We are not really looking at government being an outcome funder, but we do plan to work very closely with the government in terms of designing the program and in terms of agreeing upon, say, for example, the geographical scope of the program. So I hope I answered your question.
The next question is again for Shweta. Where will this project be implemented?
Yeah, thanks for that question. So we are currently really looking at, in terms of geographical focus, we are looking at 3 districts of Gujarat. We haven't really, narrowed down the districts yet. We would like to do it, in discussion with several of our stakeholders. But to answer your question in terms of geographical scope, we are looking at select districts in the state of Gujarat in India.
Someone has asked, how can we connect after this event if we are interested to partner in the pay for performance instrument for mental health in India? I will be connecting you, Adina, to Shweta through an email.
Sure, absolutely. Thanks, Kavita.
The next question is, this is again for you, Shweta. How do you prioritize diseases to focus on for this project?
So that's a great question. Considering the way mental health itself is, it's a very, very kind of a disease area. So we evaluated mental health diseases as per DSM-5 list, across 3 parameters. Number 1 being the burden, the prevalence of the disease. The other one was magnitude, and the third was stakeholder focus. So in terms of magnitude, we looked at, what is the degree of severity among the patients? What are the number of years lost due to, disability due to the disease, a particular condition in mental health? What are the risks in terms of comorbidity or mortality? In terms of stakeholder focus for our project, it was important to understand, does government have a dedicated program which is focused for this disease? What is the extent in which there are, good, NGO partners or service providers that are active in that space? And of course, is this disease been a focus of area for donors so far? So those were the kind of, considerations, a kind of parameters around the burden, around the magnitude of the disorder, as well as the stakeholders. Those were the considerations on which we evaluated and, looked at depression and neurosis and schizophrenia as part of our project.
The next question is for you, Dr. Ashwin. What is the situation of late-stage innovations funding in India?
Situation for late-stage innovation funding. I think there are 2 ways to look at this. The short answer is there's not enough funding. But the other answer is that there is funding available for technologies which have scaled to a reasonable extent. So it's a chicken or egg problem. So people who want to invest in technologies at a later stage are not finding enough technologies. And people who are investing in early stage are struggling to see their investment mature. So it's a peculiar situation. What we believe is if we can build the missing piece, which is validation of early stage technology, more investment will come in. Also, to be fair, over the last 10 years, I think there has been a significant increase in the investment, both from private sector and philanthropic side in medical technology, medical services, and diagnostics. And so we see that this as an increasingly, positive sort of sector. The challenge, however, is what happens after you make the investment. How do you make sure that the technology eventually sees the market that it needs to see?
The next question is for Shweta. Is BCC going to be a component of the study? Will you look for partners for collaborating on this?
Yeah, thanks, Kavita, for this question. Of course, we are, in fact, we are in the process of shortlisting service providers. And we do have, select service providers that we wish to work with as part of this project. So I hope I answered that question, that we are looking for collaborators, but for now, in terms of service provider, we have shortlisted and selected a service provider to implement the project.
The next question is for you, Dr. Ashwin. What are the challenges on hospital side, especially on adopting innovations?
I think on the hospital side, we find that there are two distinct challenges. The first one is that the clinicians are struggling to find validated technologies that they can trust and adopt, which is a problem that we are focused on. The other problem, which is also emerging, is that clinicians, particularly in the Indian health sector, are not trained or aware of how to work with medical technology at early stage. So the focus on trying out new technology, etc., becomes a little bit of a challenge, and which again creates a barrier for medical technology. I think over the last few years, however, things are changing, and the National Health Authority, which is now creating world's largest health insurance platform in India, through its 20-odd thousand hospitals, is now encouraging hospitals to look at innovation in a very positive way, and also incentivizing them to adopt technology to both solve problems at the clinical level and also at the operational level.
The next question is for you, Shweta. What are the long-term plans for the impact bond if it is successful?
Well, that's a great question, Kavita. Now, usually, as an impact bond, we do have, predetermined success metrics of, what really success looks like for that particular project. But in terms of, if you look at a long-term success of any project, I think is when, it can be scaled up, if it is replicable. So really, if you have to, look at a long-term success of any project from in this space, it would be, if you can really kind of prove a great proof of concept, and if you can really scale up and, get more funding and really scale up, and this innovative, mental health care delivery model that we are planning, the best gold standard, I would say, of any such kind of project or experiment is that if the government finds value in it, and if they would like to kind of include it in their national program as a particular strategy or as a global best practice. So to me, that would be like a really long-term success or gold standard for a project of this nature.
The next question is for you, Dr. Ashwin. Are there any matrices designed to assess the last mile delivery through medtech? Is this a part of the design of your program?
Sorry, if I understood the question correctly, are there matrices to assess the relevance or the efficacy of the medical technology in the last mile? Yeah.
Yes.
So yes, indeed, we work through our partners. So everything that we do here is done in association with our partners. So we have partners who have been in the field of medical technology and diagnostics for many years, both in India and across the world. So we seek their help to design these matrices, but we have metrics to decide which technologies would this platform support, and then how do we validate whether it is useful, both from a clinical perspective, affordability, and usability in the relevant settings. So these metrics are defined for the projects that we are already working with, but also as new technologies and new test beds come, we tweak these matrices to make sure that it is relevant to the problem that we are solving.
The next question is again for you. What can be the few areas for collaboration with local government bodies to ensure that healthcare reaches all?
Yeah, I think that's an interesting question and also an interesting challenge that needs to be addressed. Many a times when we interact with government agencies, um, it's very hard to find out what are the critical needs and what are the priority areas. So there's a little bit of work that has to be done, not only with the government body, but also the other stakeholders like hospitals in the network and other people to figure out what would make the most sense. And so we use that approach to work with various stakeholders. But clearly, from what we have seen in the states we work with, there is a need to focus on both the communicable disease side, which is coming into more prominence because of COVID, but also things like what Shweta mentioned, mental health and long-term impact of these going forward. And also not to forget the huge burden of non-communicable diseases that currently exists in various states that needs to be addressed. The other side of this is we are also seeing that innovation is required not just in medical technology in terms of diagnosis, but also improving efficiency of clinical processes, efficiency of managing hospitals and healthcare systems, and even improvement in delivery of public health programs. And it could range from behavioral intervention to training of health workers on the ground.
The next question is for you, Shweta. What is the role of J&J in this impact bond? Is J&J paying for the outcomes?
Thanks, Kavita. That's a great question. Well, in a way, like I said, we are not looking for government really to be an upfront outcome funder here. So it will be, we will be reaching out to the larger donor and philanthropic community. As J&J, currently our role is to really stand up the bond. I think that's where the biggest challenge really lies in a very, very challenging area of mental health space. Something like this has never been really tried in India. So we are open in terms of our role, but it's not really decided, I would say, whether we will be. And like I said, we are seeking donor opportunities. We are seeking private philanthropists to really become outcome funders for this project.
The next question is for you, Dr. Ashwin. Most funders are keen to see implementation of technology innovations on the ground, but late stage funding becomes a challenge. How do you address that?
Yeah, it is indeed a challenge. I think late stage, the amount of investment needed becomes a huge challenge. And the way we see this is there are two people who will pay for technology at the late stage. One is the end user who will eventually adopt this technology, and a third party like a government or a private sector, like a venture capital firm. We have seen over the last few years that there are few examples that have come out of the innovation stage all the way to market deployment, and we work with some of them. For example, a leading company in eye care in India is Porus, which started off in India, built a huge brand here, and now also servicing clients all over the world. So they built their initial business with venture capital money, but eventually most of their development efforts were supported by customer revenue. So we see that there is a continuum from incubation funds, maybe from the government, venture capital, all the way to customer paying for this. And this is only going to increase in the next few years.
The next question is for you, Shweta. What is the role of the government in your bond?
Thanks, Kavita. For now, we are looking at definitely an alignment with the government in terms of, like I said, like we have some broad understanding of the scope. We have some broad understanding of where we would like to kind of implement. But the role of the government really will be to kind of steer us in the right direction, working really closely with the government as well as with the local and the state government in terms of I would say, identifying and the scope of the project. The role of the government will also be important because if you look at the delivery, the project delivery, model that we have, it is very much embedded within the public health system. So though we are using community volunteers, which are champions who will be working with community in terms of getting the patients, raising awareness and getting patients really to the point of, say, a public health setup. But once it's, our model is very much, uh, embedded within the public health system, as in there is no, parallel, service delivery or treatment centers that we are planning. So it will be very much embedded within the current public health setup of the government. So I hope I answered the question. So that will broadly be, I would say, I wouldn't say the role of the government. I would say that would broadly be the kind of engagement that we will have with the government for now, for the project.
Dr. Ashwin, someone wants to know, are there any successful global examples that have set a precedence in scaling late-stage innovations?
There are many, and maybe I can share one such example and how we are learning and collaborating with them. So the NHS in the UK identified similar problem that there are many innovative technologies which come out of universities and other labs, and they are not getting into the hospital. So they created the NHS test bed facility by identifying key hospitals across their networks and also inviting hospitals to be participating for a period of 6 months to 1 year. So I think that's a fairly robust model which has been working over the last 3 years or so, and we are learning from them. I think the key element of this is how can you bring in various stakeholders who don't necessarily talk to each other but are critical for the success of medical technology. And our role has been very clearly to identify these partners who we can bring in, and then bring in the funders who have either already invested in early stage innovations or who are interested in late stage innovation, and figuring out how we can build this pipeline of products which can move from the very early stage to the market stage.
The next question is again for you. Dr. Ashwin, is there some sort of funders consortium or platform who can be approached for funding the validation of the prototypes of innovations or to take it to the regulatory approval level?
Yeah, so this is an interesting question, and it has two parts. One is for the prototype stage and the other one is the regulatory approval. And my suggestion is that these are two different problems solved by two different types of funding. The prototyping part is solved by early stage innovators, incubators, government funding, pilots, etc. And the regulatory approval is clearly later stage, which requires a lot more investment and infrastructural support. So there are multiple players, starting from BIRAC, which is the government agency, to private players and industry bodies, but really depends on what subsegment of medical technology that you are looking at and finding the right partners to support you through this journey.
So the next question follows in from this. Someone wants to know anyone other than BIRAC that funds testing of innovative devices and scaling up?
There are many. If you look at the government side, there is, in addition to BIRAC, there is Millennium Alliance. There is the foundations like the Gates Foundation and others who are very actively looking at this space and also focused on the entire spectrum of medtech innovation. Over the last 10 years, India has had a very robust private investment going into medical innovation as well. And over the last 5 years, we have seen an increasing interest and investment in digital health technologies, both at the enterprise level and at the consumer level. And our assessment is that going forward, investment will not be the bottleneck. but how do you create the ecosystem that investment really matures as the technology also matures? So I think that would be the big challenge, and we hope that we will play some role in solving that issue.
The next question is for you, Shweta. How did you prioritize the outcomes for your project?
Well, thanks. That's a great question. So we looked at three parameters actually. So the first being what was the gap in care. So where is it that we can make an impact, for the purpose of the project. The other one was what is the linkage to impact. So how does this outcome really, affect the overall improvement in well-being, mental health well-being. And the third was, of course, the time to impact. So for the purpose of the project, it was essential to know that how long, or what is the time period it will take for us to show improvement. So for example, will it take, less than 3 years to see and measure impact? Will it take, say, 3 to 5 years or more than that? So those were the kind of parameters, gaps in the care, linkage to impact, and time to impact were the three parameters that we took in order to prioritize the outcomes.
Dr. Ashwin, what would be the few policy recommendations for ease of medtech industry?
So there are obviously regulatory challenges given the evolving state of medtech innovation here in India. But one area that we feel could help accelerate the pace is creating transparent procurement policies for medical technology, and also laying out what is the validation data that is required for procurement at public hospitals. Because today it is fairly opaque, and there's a lot of I would say, legal or regulatory hurdles that need to be passed before they can be adopted by public sector. So sort of creating a one-stop or one window solution to new startups and innovators to go through the process and be part of the public health infrastructure would be very, very useful.
The next question again is for you. Can you suggest a few good success stories to refer to start a medtech startup?
Oh, that's an interesting question, and probably I don't know the answer to that, to start a medtech startup. But I think, given the geography that we operate in and given the times we operate in, I think there's so many challenges, and health is becoming a very, very important issue. And I think opportunities are across the board. It's a question of figuring out what is of interest to you and picking that area. But from our point of view, I think there's all kinds of opportunities opening up in the health sector, not only to address long-standing issues of communicable diseases, but also focusing on the non-communicable side, and also the whole area of digital and consumer health, which is evolving, and people have really taken to digital technologies in the last few months. We see that there is a significant shift in the way that we invest in and also consume healthcare in the future.
I don't think we have any more questions to go with. So I would thank everyone for participating in this interesting session. And thank you very much, Dr. Ashwin and Shweta. We will be publishing the recording of this session on our website next week. So please look out for it in case you want to revisit this. And I do have an announcement, and that is the AVPN's Impact Capital Festival, South Asia Impact Capital Festival, is going to be in the month of February, and the registrations are open. So please visit this link to register for this event. The registrations are free, so kindly register yourself as soon as possible because the agenda is going to get live. So once again, thank you everyone for joining today.